With at least one confirmed monkeypox case in Toronto, efforts are ramping up to address early misconceptions about the virus and reduce potential stigma.
I think what we're hearing really spans from curiosity, plenty of questions.
At the Gay Men's Sexual Health Alliance, Director Dane Griffiths, among those on the front lines, working to get factual information about monkeypox as it's being learned out in the community.
We're really just saying that this is something to pay attention to. There's certainly a lot that we know about monkeypox, but there are plenty of outstanding questions.
The need escalating amid reports several of the confirmed and suspected monkeypox cases involve men who have sex with men, something that has fueled intolerance before during the HIV and AIDS epidemics.
Illnesses, viruses, diseases like monkeypox don't have a sexual orientation.
Those who are a part of and work with the LGBTQ2S+ community say we're hearing about this connection now likely because of a commitment to sexual health testing and assessments.
That continues, I think, a long history of health-seeking behavior by gay and bisexual men to engage with public health and with our sexual health clinics, and we certainly, want to see that continue.
It's a sentiment St. Michael's Hospital infectious diseases physician Dr. Daryl Tan agrees with.
Sexual minority communities have a history of resilience, of self-reliance, of looking out for each other, of creativity in the face of adversity.
Tan met with community organizations recently to address questions. During our lengthy conversation, a candid admission.
As a scientist and as a physician, I feel it really, really acutely just how much we don't know. We know some things, but there's an awful lot that we still don't know.
Things like the sequence and severity of symptoms, the typical length of illness, lasting effects, among the topics doctors are still trying to understand. As for what is known,
so it's definitely true to say that most people who get it survive. That's absolutely the case.
Also, while transmission is still trying to be better understood, monkeypox is not deemed a sexually transmitted infection. Tan says there's no go-to drug yet, but some antivirals can provide support. It's believed it can be shared through direct contact with someone who has the virus, such as a lesion or exposure to contaminated objects. Respiratory droplets during lengthier contact with someone, also a potential way, but Tan says it's not typically the most efficient way.
We do need to keep an open mind. It's really early days. I definitely don't think that there's a need for panic at all.
Meanwhile, as we all learn in real time about monkeypox and its evolution, Griffiths with these words.
Notions of blame, of stigma, of discrimination are never acceptable. Reach out and see how your friends and family are doing if they are, part of our community.
In Toronto, Nick Westoll, City News.